Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with chest pain or trouble breathing or your heart is racing. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Now remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency department with chest pain or trouble breathing, or you feel like your heart is racing. Remember that almost all of the things that can cause chest pain can also cause trouble breathing, and vice versa. This is because both your heart and your lungs are inside your chest cavity. A problem with either your heart or your lungs can cause chest pain. So, here is what your doctor is thinking. The first thought is, could it be a heart attack? Now, what is a heart attack? It's usually when the heart is not getting enough blood supply and therefore not enough oxygen. All tissues in your body, even your heart, need oxygen to survive. And if the heart does not receive oxygen for a certain period of time, parts of the heart can start going through infarction, which means the cells are dying due to lack of oxygen. This is why we call it myocardial, heart muscle, infarction, death. This usually happens from a blockage of the blood vessels around the heart. This can also lead to heart failure, meaning that the heart muscle is no longer able to perform its main job of pumping blood through your body because parts of it have died off. I'm not trying to scare you, but these are things your doctor is always thinking about when you come into the emergency department with chest pain or trouble breathing. Your doctor is also thinking of other causes, such as abnormal electrical signals of the heart called arrhythmias. Remember, there are many types of arrhythmias and we won't have time to go through each one during this video. However, your doctor is aware of these arrhythmias and is always looking for them. Please be aware, there are many causes that could be responsible for your chest pain, and I'm only covering very few here. Your doctor is also always thinking about potential viral infections of the heart that could be leading to inflammation of the heart or heart failure. These are known as pericarditis or myocarditis. Also, in certain situations, fluid can build up around the heart, causing the heart to have difficulty beating appropriately. This is called pericardial effusion. Beyond all of this, there may be issues completely unrelated to the heart. These can often be issues with the lungs, such as viral or bacterial infections, known as pneumonia. Even fluid in the lung, known as pleural effusion, blood clots in the arteries of the lungs, known as pulmonary embolism, and lung collapse, known as pneumothorax. There may even be issues with the main blood vessel of the body, known as the aorta, in cases where it enlarges or tears, known as aortic dilation or dissection. Also, note that COPD or asthma and other respiratory conditions can cause both chest pain and trouble breathing. To add just a little bit more confusion, even issues with your esophagus or stomach can sometimes cause chest pain or a sensation of difficulty breathing. This is why it's important for a skilled emergency doctor to listen to your complaint, examine you, and make a decision on what needs to be done next. You will almost always be getting an EKG when you come into the emergency department for chest pain. This checks the rhythm of your heart and can sometimes help your doctor check if you're having a heart attack. Additionally, your doctor will likely be getting blood work to check for infections, blood loss, and electrolyte issues. Your doctor may even get a chest x-ray and other imaging depending on the situation. Included in the blood work will likely be something called a troponin, which tests for cardiac damage. Remember, we discussed how a heart attack happens when part of the heart dies due to lack of oxygen. These dead cells release something called troponin, which we can actually check for in your blood. As a special note, even if this troponin is normal at first, your doctor may have you wait another 2 to 3 hours after your first blood draw to get another troponin level. This is to make sure that it is not changing. Please be patient with your doctor as they try to make sure that you have a low chance of something dangerous happening. With chest pain, there is usually a lot to consider, and you may be in the emergency department for quite some time. Remember that your doctor is following all of your results in the background, and part of your visit includes cardiac monitoring for a few hours. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations. And if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure that nothing was missed on the first visit. Depending on the cause of your chest pain, your doctor may encourage you to follow up with a cardiologist. Now, this is not a soft recommendation, we really mean it. Oftentimes, poor blood flow to the heart, called angina, might not be detected with our tests, which are only meant to detect actual cardiac damage. This is why we tell you to go see a cardiologist for further testing, especially if we think you might have a potential risk of having a future heart attack. I know that being in the emergency department can be an incredibly stressful experience. I hope this has been helpful for you. Again, this is Dr. Karl Yousef. Wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.